Chapter 23 Antidepressants and Mood Stabilizers. Depression, the most common mental illness in the United States, affecting more than 14.8 million Americans. It's characterized primarily by mood changes and loss of interest in normal activities. It has many different etiologies, everything from genetic predisposition to social and environmental factors to biological conditions. Some common signs and symptoms would include things like depressed mood, despair, unexpected weight loss or weight gain, decreased ability to think or concentrate, a loss of interest in most activities, fatigue, a loss of energy, and insomnia, hypersomnia, or suicidal thoughts. There are many different types. Beginning with reactive depression, this is usually a sudden onset after a precipitating event and usually lasts for months. There's also major depression, which may be a primary or secondary to a health problem. It would include things like a loss of interest in work or home, an inability to concentrate and complete tasks, difficulty sleeping or excess sleeping, feelings of fatigue and worthlessness, and deep depression. This would not be confused with bipolar, which is characterized by mood swings between manic and depressive. There are many different theories about the cause of depression. Everything from the common theory, which has an insufficient amount of brain monoamine transmitters, and decreased levels of serotonin to permit depression to occur, as well as the decreased levels of norepinephrine that could also be a cause of depression. In the case of complementary and alternative therapies, St. John's wort is one that you'll hear about a lot, as well as ginkgo biloba. They are suggested for the management of mild depression. They should not be taken along with prescription antidepressant medications. And you should also discontinue the use of herbal products 1 to 2 weeks before surgery. Check with your healthcare provider before taking herbal treatments. For us as the nurse, it's critical that we have an accurate med rec, and we have an accurate documentation of not only everything they're prescribed, but also everything the patient's taking at home, which St. John's wort and ginkgo biloba would definitely be included on that. Antidepressants. This is a subject we're going to get very deep in next term in mental health as well. There's several different types, everything from tricyclic antidepressants, SSRIs, or selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, atypical antidepressants, or MAOIs, monoamine oxidase inhibitors. First was tricyclic antidepressants. These block the uptake of neurotransmitters norepinephrine and serotonin within the brain. This results in an elevated mood, increased interest in activities of daily living, and decreases in insomnia. It also works to block histamine receptors, which lead to sedation. Some adverse effects of tricyclic antidepressants would include things like drowsiness, dizziness, blurred vision, sedation, dry mouth and eyes, skin rash, GI distress, constipation, urinary retention, sexual dysfunction, weight gain, seizures, orthostatic hypotension, blood dyscrasias, cardiotoxicity, dysrhythmias, and suicidal ideations. They will also have significant interactions with alcohol and other CNS depressants. MAOIs may lead to toxic psychosis, and antithyroid drugs may increase the risk for dysrhythmias. In the case of SSRIs, these block the uptake of the neurotransmitter serotonin. Causes would be uses for major depression, anxiety disorders, prevention of migraine headaches, decreased premenstrual tension syndrome, eating disorders, and substance abuse. Interactions, so it's an increased sedation with alcohol again, as well as with other CNS depressants. This is also a medication that interacts with grapefruit juice. SSRIs, cyclosporin, these are going to be very common ATI and NCLEX questions. SSRIs have side effects including headache, insomnia, blurred vision, dry mouth, erectile dysfunction, suicidal ideations, and side effects often decrease over 1 to 4 weeks. Next up would be SNRIs. These inhibit the reuptake of serotonin and norepinephrine, used for major depression, generalized anxiety disorder, and social anxiety disorder. In the case of SNRIs, side effects would be things like drowsiness, dizziness, insomnia, blurred vision, headache, amnesia, erectile and ejaculation dysfunction, and other adverse effects like tachycardia, hypertension, orthostatic hypotension, seizures, and again, suicidal ideation, which is ironic for medications that are treating depression, that so many have an adverse effect of suicidal ideations. And we'll get much further into that in mental health next term as well. Atypical antidepressants. They affect neurotransmitters such as serotonin, norepinephrine, and dopamine, used for major depression, reactive depression, interact with MAOIs, and have side effects again dry mouth, blurred vision, orthostatic hypotension, palpitations, tachycardia, erectile and ejaculatory dysfunction. Hopefully, you're noticing a lot of common themes among all of these antidepressants as well. MAOIs, or monoamine oxidase inhibitors. These work by the monoamine oxidase enzyme that inactivates norepinephrine, dopamine, epinephrine, and serotonin. It's used for depression, not controlled by tricyclic antidepressants and other second generation antidepressants. CNS stimulants such as vasoconstrictors and some cold medications containing phenylephrine and pseudoephedrine can cause hypertensive crisis when taken with an MAOI. You're also going to see the food interaction of tyramine. This is going to be another very common question. And it's going to be aged cheeses, smoked meats, dark chocolate, Italian green beans, liver, pickled foods like sauerkraut, instant coffee, things like that. Also, red wine, dark beers. We want to be very careful. And these are also very common NCLEX and ATI questions. And that you're going to have to pick the food that the patient should avoid. And it's usually going to be things like a pizza that has cheese and pepperoni, smoked meats on it, anything with pickles, anything with sauerkraut, dark chocolate, malt chocolate. Some side effects would again include dizziness, drowsiness, peripheral edema, headaches, weight gain, insomnia, anticholinergic effects, orthostatic hypotension, and hypertensive crisis from the intake of tyramine. And again, suicidal ideations. Lithium. It's not just for your phone batteries. This is a mood stabilizer. It has a therapeutic serum range of 0.8 to 1.2. And keep in mind, a serum lithium level greater than 1.5 can lead to toxicity. It alters the ion transport within muscles and nerve cells. It's used for things like bipolar and manic episodes. Again, we're a mood stabilizer. Think of mood like a pendulum, and we're slowing the swing of that pendulum. Side effects would be things like drowsiness, dizziness, blurred vision, headache, restlessness, tremors, memory impairment, dry mouth, thirst, a metallic taste, GI distress, and weight gain and loss. It interacts with many drugs, everything from thiazides, Haldol, NSAIDs, antidepressants, carbamazepine, spironolactone, sodium bicarbonate, and ACE inhibitors. It also has a decreased lithium level with things like caffeine, loop diuretics, and theophylline. A thing to keep in mind about lithium is that it's processed like a salt within the body. So anything that where the patient's excreting excess salt, they're also flushing out their lithium. On the other hand, any condition where their body's not excreting salt, they're not excreting their lithium either. So the patients are taught to maintain a steady intake of salt and sodium. A common ATI and NCLEX question you'll see for lithium is going to be what exercises the patient should avoid. And it's always going to be things like running, things that make the patient sweat profusely. When looking at antidepressants, we want to assess the patient's baseline vital signs and wait for future comparisons. We also want to assess for any mental status and suicidal ideations, keeping a careful eye out for anxiety, confusion, social isolation, and any changes in the patient's interaction with others. Observe the patient for signs of depression, mood changes, insomnia, apathy, or lack of interest in activities. Monitor vital signs, monitor for drug to drug or food to drug interactions. Provide the patient with a list of foods to avoid, and caution the patient not to consume alcohol or other CNS depressants concurrently. In the case of lithium, again, we're going to assess for suicidal ideations, look for baseline vital signs, analyze any cues for anxiety, confusion, a decreased ability to cope, and how they interact with others, how it affects their activities of daily living. Taking action, observing the patient for any hint of depression, mood changes, insomnia, apathy, monitoring vital signs, monitoring those lithium levels, which is going to be another very common ATI and NCLEX question. If a patient comes in with lithium, one of our first assessments is going to be to draw that lithium level. For our first practice question, which statement about amitriptyline does the nurse identify as being true? The drug is administered first thing in the morning. The drug should be discontinued slowly. The onset of antidepressant effects is 48 hours. And hypertension is a frequent side effect of this drug. And that answer is going to be B. The drug should be discontinued slowly. Practice question 2. A patient with reactive depression is ordered to receive fluoxetine. Which information will the nurse include when teaching this patient? A. The medication takes effect in 1 to 2 days. B. The medication increases libido. C. The medication should be taken with grapefruit juice. Or D. The medication may cause headaches and insomnia. And that answer is going to be D. The medication may cause headaches and insomnia. Remember, never give SSRIs and grapefruit juice. Question 3. Before administering a monoamine oxidase inhibitor, what is most important for the nurse to assess regarding this patient? That'd be A. Sexual history, B. Socioeconomic status, C. Tyramine food intake, or D. Hydration status. And that answer is going to be C. Tyramine food intake. As soon as you see MAOIs, immediately be on the lookout. One of these tyramine questions may be coming. Aged meats, smoked cheeses, dark beer, red wine, soy sauce is a common one. Question 4. Which laboratory test is most important for the nurse to monitor when a patient is receiving lithium? That'd be A. Urinalysis, B. Serum glucose, C. Serum electrolytes, or D. Complete blood count. That answer is going to be C. Serum electrolytes. Question 5. When providing dietary teaching for a patient taking monoamine oxidase inhibitors, the nurse should teach the patient to avoid which food? That'd be A. Cheddar cheese, B. Avocado, C. Grapefruit, or D. Potato chips. And that answer is going to be A. Cheddar cheese. And for our final question, which advice will the nurse include when teaching the patient about lithium therapy? A. Take the drug on an empty stomach. B. Eliminate all sodium from your diet. C. Stop taking the lithium when you feel better. Or D. It may take 1 to 2 weeks before you have any benefit from taking the medication. And that answer is going to be D. It may take 1 to 2 weeks before you have any benefits from taking the medication. And that's another very common theme you're going to see among antidepressants, is that they take several weeks to begin to take effect for the patient. But anyway, that's all we got for this chapter. I'll see you in the next slides.